Hello, welcome to Two Girls Without Cancer. I am your host, Becky, here with
Ashley.
and we have another fantastic episode. We are talking women's health today, specifically pelvic health, which, I don't know if there's enough talk about that.
I don't think so.
I don't know if you know much about pelvic health. I have definitely needed some help in that department. And so when I met this guest and I heard what she does and what her story was, I was like, yep, we're talking about this. So our guest is Michelle Neves. She is a biokineticist with over 18 years experience in women's health, movement rehabilitation, pelvic floor therapy. And so I cannot wait to discuss with her because I got a lot of questions.
Yeah, right.
So welcome, Michelle, to our show. Hello.
Hi, guys. Hello.
So we were talking backstage. So Michelle is from South Africa and now lives in Portugal. So it just goes to show that like what you do and how you help people, it isn't just, a North American thing, a Canadian thing, American thing. Like this is worldwide. Women are experiencing the same things worldwide.
Yeah.
It's so true.
Yeah.
So true. And it's not something that I feel is spoken about enough. It's still sort of very taboo and people still feel kind of shy about it. And there just isn't enough information on it. Often, when ladies come into the practice and sometimes they'll come in for something else like a hip pain or a back pain. And I'll go through them and I'll say, do you have pelvic floor symptoms? And most of them say to me, no, I'm fine. I don't have any leaking. And then when I start to ask more in-depth questions, they go, oh, actually, I do have this. And, oh, yes, sometimes I do get that. And it's funny how most females, regardless of whether or not they've had children, actually have experienced one or more symptoms in their lifetime, if not acutely, chronically. Which is quite a bit shocking, actually.
We're not asked those questions. I don't think I've ever had anyone ask about my floor
pelvic health.
Yeah,
I mean, like your doctor might say, "Oh, do you have burning or whatever?"
gyno.
But they probably don't say like, are you constipated or can you feel stuff moving around in there? Like, is there stuff sticking out or how's sex, how's peeing, are you peeing yourself, things like this. And so like when I did it originally, I had no idea. My friend had talked about it lots, but I didn't think that was me. Like my friend had natural births. She started to fall out inside. So she had to go to pelvic floor therapy to work that out. So I didn't have that. I had C-sections. But once I did chemotherapy and I told my doctor, I was like, man, it burns to have sex. It hurts so bad post chemotherapy. What is going on? And she said it can actually cause major inflammation in your pelvic health region. Well, what the heck? That was never a side effect that I was expecting. And so I went to a pelvic floor therapist and sure enough, it was tight and sore and inflamed in there. And it was not a comfortable treatment. I had to go many times. I should probably still be going, quite honestly. It was very uncomfortable and it is also invasive, but the relief I felt from it was crazy.
Yeah, I said I've never.
Well, maybe you should. So why don't you tell everybody,
explain how it is,
what pelvic floor therapy is?
All right. So there's two ways to approach it. One is externally and one is internally. Okay. Not everybody needs internal pelvic floor intervention, right? And that's done with very specific therapists who have studied further to do internal, because as you explained, it is very invasive and the person needs to be quite, I feel quite delicate about it. I work primarily externally. I don't do any internal pelvic floor. And there is a tremendous amount you can do externally without ever having to go internal. People that would be more candidates for internal pelvic floor therapy are kind of people who have vaginismus. So that's where they kind of have that like real cramping of the vaginal canal, the pelvic floor muscles. And you'll know if you have a vaginismus. It's not something that's like, Oh, I didn't know. You'll know you have cramping. Outside of your cycle, it's painful to have sex. It's really tight, not in a good way.
I have this. I think I have this.
Yeah, it's not tight in a good
Sure.
way. It's really sore. It's uncomfortable.
Yeah, that's me.
You know, sometimes you struggle to kind of defecate. It's really difficult to have a poo. Like it's just,
Oh,
you
yes.
just cramps. So, and that's beyond constipation. It's beyond your stool being hard. It's really actual
That's
cramping.
so interesting because ever since what I went through, I've noticed a lot lately that when it starts to come down to get ready to come, I'm like keeled over in pain, have to take a couple breaths, and then it works its way through. That's interesting.
And that's not a red flag to you?
I go to the doctor and they say, we've done every test on you. I was like, okay.
So I would
What am I
definitely,
supposed to do?
yeah, if I was you, I'd definitely pop in to see a pelvic floor therapist for that,
Probably a good
because
idea.
it could just be really severe cramping of those muscles. And I mean, if I think all of us
Interesting.
have had a cramp at some point in one muscle group, but pelvic floor is those cramps are kind of debilitating in the sense that because of well, I've got a pelvis here, I've got a small one here, because
I
it's
love it.
literally the floor of your pelvis. When this cramps, it kind of shuts down the whole chain. And I can really believe that you're keeled over in pain. It really is quite debilitating, and painful.
Yeah,
So
and it lasts up to 10 to 15 minutes, and then it will clear up. I've told them this, but
Girl, you get yourself to a physiotherapist. Okay.
I was going to say, yeah, definitely
I
get
have
to a
so much
pelvic floor therapist.
See, 100%. She had a lot of like core surgeries, including her bowels, her ovaries, her stomach, her peritoneal tissue, a lot of tumors, lymph nodes. So yeah, you've got some stuff
and a lot
in
of
there.
scar tissue.
You know, so you would definitely be a candidate for internal pelvic floor.
Yeah, girl.
Because you would need
Can
someone
I ask you, what do they do on that internal thing?
Okay, so the general way of doing it is you'll go in, you do your medical history, you have an assessment, blah blah blah. Then they ask you to get undressed. Usually they're usually quite nice about it. You know, it's not like the gynae where it's sit down and scooch and your legs are in the stirrups, right? So this is a little bit more delicate. They ask you to bend your knees, and they've got you covered with some sort of towel or whatever it is. And then she'll put gloves on. She uses like a gel or a lubricant, and it's usually a female. I've never come across a male pelvic floor therapist. I can't assume that they would do well. Just maybe, but I wouldn't be comfortable, to be honest. And then they kind of slide one or two fingers inside, and they literally feel around the vaginal canal inside, but they're actually feeling the muscles surrounding the vaginal canal. So they might actually find knots in there. So
really,
why I got in, just like you get, well, can I use the word knots? It's not that it's actually knotted, it's just that tissues kind of and depending on if you had natural birth or you've had some other trauma there or surgeries, you could have scar tissue, which they would work out.
They can work out scar tissue.
Well, they break it down, you know. I mean, you can't really undo the scar, but if they find really hard scar tissue in there, you know, they can kind of help break it down if that is an issue. So it's really, really interesting in terms of nerve innervation with the pelvic floor.
Well, they also removed my left ovarian fallopian tube as well in that second surgery. So,
so there's some stuff going on in there in that general direction. So when I went, I had no idea what I was expecting. My friend said prepare for an internal exam. I didn't quite know exactly what to expect. At one point, the therapist goes,
"Did you get internal?"
Oh yeah, many times.
Oh,
she comes back and she's got a vibrator with her.
I'm sorry.
And I was like, I'm sorry, what are you doing with that? And I text my friend because I got my phone as well. And I was like, what if I like this?
Oh my gosh.
Yes. Where's she putting this? And what if I like it? And I'm like, this is not okay. So anyway, she worked on like my inner thighs. She worked on like above my pubic bone. She sort of worked like near like butt cheeks almost, just with that vibrator to stimulate the muscles and just relax them.
And relax you as well,
and relax them. And then she used it like this one was a dilator, so it had like the different sizes, and we found a very low size, and like she put it on, it's vibrating, and it's like you're putting it at the 12 o'clock, the 6 o'clock,
inside
the 3. Oh yeah. And she's holding it. And so we would find the areas like me sort of specifically, it's more around that like oh gosh, can I tell time? Like a 2 o'clock. And so like, we're like almost like putting pressure. Like if this is the whole, it's like pushing pressure on it. So, and then, so I had to buy a dilator and I have to like do the exercises at home. And quite often pre-sex, I have to like do it just to loosen it. Yeah. Like to
relax.
prepare the area. Otherwise sex is very painful for me.
Interesting.
You know, each female kind of experiences different symptoms. So we have, you know, when we're asking questions, we're kind of dividing it into 3, like anterior, middle, and posterior part of the pelvic floor. So I'm just going to pull my model out here. If you ladies don't mind. Let me just put this down for a second. I actually had it ready and then packed it away and then I was ready again. All right. So if we look at, isn't she lovely?
Right?
Oh, I love that.
I'm learning so much.
I think she's so beautiful. I'm like, I can hear that song in the background, you know, isn't she lovely?
Oh, that's cute.
Yes, that's the one. All right. So if we look at pelvic floor from underneath, right? So we've taken away the hip and the leg. This is what we look like underneath when you take away the folds and the outside lips, the labia majora. So I'm going to just put it closer. So we're kind of looking at, this is posterior, this is middle, and that's anterior. So anterior, we're looking at any symptoms to do with the bladder. So like leaking, frequent urination that's not linked to drinking water. Lots of small
I drink so much water.
Well, you see, again, it depends on the amount of wee. Like, is it a big wee or is it like a little wee? Or if you go for a wee and you finish weeing and then you think, I think I still need to wee again. Or it's kind of this thing of kind of always feeling full or feeling pressure. So those are kind of some of the anterior symptoms. Middle would be anything to do with the vaginal canal. So, sorry, over there. So we're looking at, again, it's usually related to sexual activity. So pain during sex or after sex, pain during orgasm, inability to have an orgasm, weak orgasms, cramping outside of, you know, the normal PMS or menstrual cycle cramping. That's kind of what we're looking at. Or a tremendous amount of flaccidity as well. Like some females after they give natural birth are just so flaccid, it doesn't always return to, you know, the shape.
Like wetness?
No, like flaccid, like full, unfold, loose, or firm.
Yes. Or kind of if prolapsing, right? So some females have the uterine prolapse or the bladder prolapse or the rectal prolapse. So that's actually falling into the vaginal canal. So you'll feel that in there, like there's something there that shouldn't quite be there.
Right. My friend who had a prolapse, she could literally see something coming, like a bubble coming out of her vagina. And she was like, what the heck is this? And it was a prolapse. Yeah.
Oh my God.
Yeah, that's already quite far along. Yeah.
Yes, it was.
Wow.
Was it a uterus or her bladder?
I think it was her uterus.
Yeah.
I'm almost positive it was her uterus, but she had to have surgery. And
that's insane. So they tacked her back up?
Yeah, and she's had no issues since. Sex is fine for her, whatever. Any self-stimulation is fine. Anyway, she probably doesn't want me sharing all this on here.
That's Becky.
And then, like we said, posterior symptoms would be everything to do with number 2s, right? Defecation. So cramping, pain, inability to poop, those sort of things. So you could actually have tension. Well. Pardon?
It can be like multiple, not just anterior or posterior. It can be both, because I feel like I'm middle and down.
Yes, you could definitely have more than one, because if you, let's just take out all the organs here quickly.
Oh, it's removable. It's cute.
Like, it's very cool. So if I can show you there, like this is actually one layer here, this top layer.
A muscle?
To me, it kind of looks like a squid. This kind of,
it does.
Yeah,
a little squiddy.
That's our
right?
butthole.
That's your butthole. Yes.
Okay.
And then this is the second layer here, and then if you look inside, there's this third layer.
Interesting.
Oh, wow. So it's literally the floor of your pelvis. Like, you know, if we've taken away the legs here, this is the floor. There's your bum bones. That's what you sit on when you're sitting, right? It's kind of, there's your coccyx, there's your bum bones, there's your pelvic floor, just hanging out. Literally.
Would someone who struggles to like sit comfortably, like their bottom always hurts, like Ashley currently sitting on a rubber donut?
Yes.
Could that be a pelvic floor thing?
You know, if I listen to your symptoms where you're saying, you really struggle to defecate, you take 15 minutes and they can't find anything wrong with you, which is not a bad thing, right? Because then it means there's nothing seriously wrong that you need surgical intervention. So it could just be from all the surgeries and the stress and everything you've been through. You have so much tension in these areas because the pelvic floor is also really linked to our emotional state. Just like the diaphragm. So all these, these two kind of work together, diaphragm and pelvic floor. So any amount of stress, negative or positive stress, is going to affect that pelvic floor. So I would definitely, especially if you're also struggling to sit on it and you have excessive tension, go see someone, because they'll
long
give you
periods of time. I can't. I gotta use this donut.
Yeah, so I would definitely go
even
see
my
a pelvic floor
tailbone. Like
therapist.
it started with my tailbone was just like I couldn't even sit at all.
Sit on
Mostly
it.
laying down. Yeah, I couldn't. It was just so much pain. It's gotten a bit better, but I still have to use the donut. Like when we're recording or when I'm out doctor's appointments, I bring it with me.
Yeah, I would definitely get it checked out. Look, it depends on the severity of symptoms. If you told me those symptoms, I'd say get it checked out. Make sure they aren't like, really bad hemorrhoids or there isn't something else worse.
Can't
The
you
fact,
see hemorrhoids?
Not
Or
the
not
internal
always?
one.
unless they're inside the rectum, but I don't know if they'd check that with you.
Yeah, I don't know.
I had to
But
get
I've
that
done-
checked also by this very gentle student doctor, very small fingers, but she definitely checked rectally for the inside.
I've had colonoscopies. I've had 3.
But they're
So-
See,
checking
they
your
would have
colon,
seen-
not your.
Yeah,
They have to
they
go up
didn't go
through there.
under. Yeah, they would have. I think if they saw something, really severe, they would have said something. So it
Yeah, right?
Yeah.
It sounds like excessive tension, which is really common. I've had that too. That's how I started my pelvic floor journey. This wasn't something that was discussed in movement science 20 years ago.
I'm actually really excited for this because I've never talked about this. I don't even think we've ever talked about this. No. Now I want to do it.
We'll book
Nice.
together.
We have to.
Oh, that'd be so sweet. Yes, you can give each
Maybe
other
this is the same
support.
time.
Put us in adjoining beds. This is a couple's pelvic floor day,
Couples pelvic floor. Get 2 therapists.
right? Bring
We
them
would
both in.
do
We
it.
want to be able to chat while we're doing this. Yeah, I mean, it is a very intimate moment for sure with a stranger. I mean, it is very intimidating. Just like getting a pap is intimidating. Only she's there for half an hour or longer with you.
Interesting.
Doing things, looking at it, watching how it reacts, moving it in certain ways where like, the pap is kind of in and out, right?
Yeah, that's going to be
It is a very humbling experience for sure, but it is very relieving. Like I like literally it always hurt to have sex, always. And then now it's like if I can prepare ahead of time, it takes that pressure off.
So once you prepare, it's okay.
Yeah, it also, maybe you can speak more to this, but it also, for me, someone who I said I dried out after chemo.
Sometimes I do.
Dried out in every aspect of my body, which makes sex also very painful. But it's kind of started again after doing exercises.
After this thing?
Yeah, after doing my exercises at home with it.
Ooh, another question, excuse me. Kegels? Does that?
Kegels. Kegels. I'm like, okay. Well, Kegels are a very important part of pelvic floor therapy. They're not the only thing of pelvic floor therapy. They've really sort of blown up on social media, and there is a big place for them, but it is not the solution for everybody. So, when we're looking at pelvic floor, we're looking at people's breathing function, how well they're using the diaphragm. We're looking at their deep core muscles, specifically like there's this big corset one that we call the transverse abdominis. I'm going to quiz you later.
The one that's been sliced open.
That we're looking at the abdominal function. We're looking how well the glutes function, the bum muscles, the hip muscles, and then we're looking at pelvic floor and the synchronicity of all that. So Kegels are important, but for example, someone who has a vaginismus or a tremendous amount of tightness might not actually need Kegels. They might need relaxation first and then retraining. Whereas if they do Kegels,
put more strength over this tight.
Yes, because you're just like, let me pull out my vaginal canal. All right. So
There she is.
What's that? Was that our
Yes,
That's
canal?
vagina.
so this is the uterus. I don't know why they made it blue, but they did.
Okay, all right. It's like a cowboy hat. That's cute.
Oh, that is very cute. Like. So, yeah, if you look at the vaginal canal, obviously this is a very small one, but it's literally a canal of like, muscle tissue. So if you're doing Kegels, you're just making this tighter. It's going to make, intercourse and any sort of intimate activity really difficult, especially if it takes you a longer time to warm up, or, if you're struggling with lubrication, like during perimenopause or menopause, plays a big role in kind of that ability to lubricate.
Interesting.
Makes
And it
sense.
actually makes sense. Like my daughter is in physio for her legs, but I keep saying, like, why is this guy not giving you any exercises? But I asked him about it and he said, because her muscles are so tight, if I start strengthening them where they're at, they're going to strengthen in the wrong way. He's like, I want to loosen them all first and then train them again. So it's the same concept, which I've never
Makes
heard
sense
before as far as like Kegels and stuff go. I thought those were just like the go-to, but that makes perfect sense for someone like me who did have a lot of tension that needed releasing. Doing a Kegel wasn't, and now that I think about it, like she never actually had me doing those at all.
Yeah, you wouldn't be, from what you've told me, you wouldn't be a candidate for Kegels in the beginning. You would be relaxation. So,
It was
with you,
more
we would
breath
look at,
work. It
I was
was
going
more
to
like,
say,
it was like hold
yes.
it while you breathe in and then let out or something when you release. And it was very hard to like link the two up, my diaphragm with my pelvic floor.
Sure.
It was very tough to line up the two. I struggled with that.
I would.
Yes, because that's often where the dysfunction occurs. It's not just pelvic floor. It's this whole kinetic chain from here upwards. Because you've got, like I said, the transverse abdominis, this big abdominal, and then you've got the diaphragm here. So it kind of works like this big balloon. And if you kind of, have a balloon and you press on one side, it affects the other side of the balloon. It's kind of like this closed system. So with a lot of females, we actually end up doing breath work and relaxation work, like trying to get them to actually relax pelvic floor. Because they've got so much strength or tightness that pelvic floor doesn't actually know how to relax. It's like contracting your bicep the whole day. I mean, it's not really functional. What am I going to do with this? I can't do anything.
Yeah,
So
really. And then if
it's
you went
really,
to touch it at the end of the day, it's probably sore from exercising all day long.
yes.
Interesting. That does make sense. I'm thinking too, like for women, well, probably for anybody, but again, just speaking as a woman, when something is like stressing me out, I find I'm clenched. My butt's clenched. Everything is clenched. So I feel like I'm just holding a lot of pressure in my pelvis all the time. And I also, and maybe this doesn't relate to, as a girl, I was always like too scared to use the bathroom anywhere that I went. Like you don't poo in public.
Really?
And so I'm like forever holding everything in there. You don't fart in public, you don't poop in public. So then I'm like always holding everything.
So different.
I feel so that's good to know. But I do feel like that would contribute as well when you're constantly in a state of this instead of a state of this, right? Tight.
Yes.
So I've done this.
Especially,
it's like stress too, right?
well, like I said earlier, the stress response plays a massive role in terms of the two branches of the nervous system. So, I'm sure you've heard of someone talk about the parasympathetic and the sympathetic branch. So the stress branch and the relaxed branch, right? Sympathetic is the stress branch. And I don't know if you've, to talk about this on a live podcast, to talk about, I don't know if you've ever seen certain mammals when they catch a fright, like they'll just have a poo. They're like, just have a poo and then they run away. Right? Okay. So that stress response system also exists in us. Okay. That's why some people, when they get really nervous, they're like, I need to wee or I need to go to the bathroom, because your brain's sitting there going, we're going to take on the line. Your body doesn't know that the stressor is emotional and mental. Your body goes, we're stressed. We have to prepare to like run away, get attacked, the lion's coming to eat us. So it goes, I have to empty my bowels and empty my bladder so I can run or fight or do whatever it is I need to. But now we've kind of got all these mental and emotional stresses, right? There's hopefully no lion coming to eat us. We're not getting attacked, touch wood. So we're constantly navigating kind of, can I say, urban or civil life versus the stress response, which is really quite old, So yes, that clenching will make it 100 times worse. And as women, we've also been taught, I find this thing of like, I'm going to go for a quick wee, or I'm just going to wee before I go out. I don't know if you guys had that sort of culture
I
there,
always
but
go
we had
before
that.
I leave the house.
It's one of the worst things you can do for your bladder, because your bladder is actually not full enough to give you a signal. So we're overriding that signal the whole time,
Right.
right? So let me
So
get
you're
my little
saying
bladder.
don't go proactively, go when you actually need to.
Darn it, I do it to my kid too. I'm like, we gotta make sure we go pee because it's a long ride.
But with a
Well,
kid, he needs to go pee the second you get in that
Yeah.
car. It's always the
Yeah.
way.
Children, it's a little bit harder to navigate because they just kind of pee when they want to pee. Whereas I suppose, each parent's going to navigate that situation differently. But as adults, I used to do it too. I used to go, I'm gonna wee, and it's different. Like if I know I'm going to do a really long trip and there's no bathroom on the way, I'll probably do it just to prevent having to go. But it's not something I do often because the bladder is it's like a little, here's my bladder. Okay. And so once it gets to a certain point, it signals to the brain, hang on, I'm full, it's time to empty. But if you are constantly emptying at a lower point, you are resetting that.
Interesting.
Lowering that threshold.
Yes, that's perfect. Yeah, that
That
threshold. So then you're kind of going more and more often, and we're weakening things. And then you add 10, 20, 30, 40 years, you add menopause and childbirth and everything.
Wow.
And then we wonder why we have dysfunction, especially 35-year-olds and up. Yeah.
Crazy.
Interesting.
Isn't that so? That just blew my mind.
So what about children with pelvic floor? So my youngest, she had accidents up until she was about 9.
Like wash it pee-pee?
Yeah, like she would always smell like pee, and I'm like, what is that?
Really?
You're 9 years old, what is happening? And so we took her to a specialist who did biofeedback therapy, where they hooked her up to these little vibrating sort of nodes, and they put them in those relaxed sort of areas, and then she would play a game with it. So she would it was hooked up, and then so it was like, okay, like catch all the coins, you're a dolphin, catch all the coins. So as to get the dolphin to move up higher, she'd have to squeeze, and to get it lower, you'd have to relax. And now my friend also bought a toy like this, let's say, looks like a sex toy. It's not, it's hooked up to a game on her phone. So same thing. So like this biofeedback, it is so interesting to me.
Right?
What do you think of these things?
So in terms of children, I did pediatrics for a long time, but I didn't do pediatric pelvic floor, so I can't really comment on how you'd address that ethically with the child and the parents. So that I can't weigh in more there. But the biofeedback tools are really not, again, not every patient needs them, but they are really, really nice way to get someone to take a tool home and be kind of proactive with it. In some cases people need to learn how to relax, and other cases people need to learn how to contract. So those little tools, it looks like a little sex toy, and it's just kind of picking up your signals, just literally biofeedback.
You just put it inside and
you put inside, and some of them, depending on what you get, like the you also get tools where there's a vibration added. So for example, I'm working with a patient now who's had natural childbirth, and they had to use the forceps to pull the baby out, and she was kind of in the middle of contraction, and they pulled, and anyway, she's got a lot of flaccidity now post. So she's working with me and someone who does internal. So I do the external stuff. She does all the internal stuff, the other therapist. And I said, look, you're definitely a candidate for internal, because she had no pelvic floor contraction. She couldn't, she'd complete, and we had done prenatal rehab. So I worked with her before she got pregnant and during her pregnancy doing pelvic floor work to prevent all this. And she was like, it's so weird for me. I can't feel my pelvic floor. It's non-existent. It's just not there. And she had a lot of accidents as a result, obviously. And so they're using biofeedback with her, but actually the vibration, because now they're trying to vibrate the muscles inside so that they're putting sensory input, to help her in the brain kind of figure out what's happening in that pelvic floor.
Yeah, almost to like recreate synapses that were lost in trauma, right? That's very interesting.
I'm very interested.
And again, this isn't spoken about enough.
No.
Everyone talks
honestly.
about pelvic floor during pregnancy, like do 100 Kegels, but no one's telling you, for your cesarean, you should probably see a pelvic floor therapist to work on the scar and get those abs back. And no one's telling the mothers who've had natural birth, even if they had a small tear or a big tear, and they've had stitches, to actually go and get seen by a pelvic floor therapist. It's kind of like, you have a baby now, you're a mom, like you don't matter anymore.
Deal with it.
That's kind of the message I
Be in
get.
pain for the rest of your life. Yeah. I know when I had seen my girl, she had said it's kind of a combination. It wasn't just chemo. Chemo just inflamed the area to the point where I noticed it. But she had said, like I have scoliosis. So like just growing could have caused like the tightness there. I had an ablation and a bilateral self-injectomy, like where they took my tubes out. She said that can cause it as well. She said just, like the way that your posture and everything is can cause it, like, and trauma for a lot of people too can cause it. So there's like a lot of contributing factors. Plus I had C-sections as well. Just a lot of contributing factors can cause somebody to start feeling this way. And we don't even know it, again, because nobody talks about it.
I had no idea until today. Now I'm like,
yeah, you do need
it.
You do. Like, apparently nothing should really hurt. Like, sex should not hurt?
Sex should not be painful. No.
Sex is very painful.
I get it.
It should not be painful.
It does, because like I'm trying to, these abs, I don't have any, so I can't contract them.
Again, like you were saying, like if you have like the core, if your core is not tight, like that can cause it too, right? Like if you have that
so potentially could I have a prolapse even though I got all my stuff? Well, sort of, like in that area, just the ovary and fallopian tube.
Well, prolapse happens more with people who've had natural births or some sort of really intense sexual trauma, but a prolapse, generally people who have a prolapse will say they can feel something in the vaginal canal. So even their partner can sometimes feel something. The partner will say, I can feel something there that wasn't there before. So something is, if we kind of think of like a sleeve, right? So you got the vaginal canal, right? And now something is kind of collapsing into that sleeve. So either it's the rectum, or it's the bladder, or it's the actual uterus that's kind of collapsing into that canal. So generally people will know, they just kind of ignore it. They go, something's kind of popping out there, it's it's my age, or it's weakness, or I'm a mom, and they just really ignore it until they've got something coming out.
Surgery.
I saw
right out the bottom.
She showed me a picture and it literally looked like a bubble coming out.
Gross.
Like it was you can't ignore that. Obviously she would have to push it back in. No, she had to push it back in though, and she was like, what the heck is this? This isn't normal.
But to get to that doesn't happen overnight. So this is happening over a prolonged period. And then once something falls out, they go, oh, maybe I should address this. Maybe it's important now, Yeah. I think it's just lack of knowledge. Like I say to a lot of the females that come to me, did you not have a discussion with your gynecologist? And they go, but the gynae never asked. And I said, okay, that's terrible. But did you also not tell them? Like, you're at the gynae, she's literally looking at your vagina. This is the time to ask a vaginal question.
About my pelvic floor.
No, they don't.
Mine's an old man. Mine's an old man. He's definitely never asked me about it. But,
unlikely. Yeah, unlikely.
Isn't that interesting?
Mine too. It's very interesting. I've been to a few over the years. No one has ever asked me. Let me give you context to my journey. Maybe it kind of puts things in context for you as well. I had pelvic floor issues from a child already, and like related to bladder symptoms. And they're like, oh, it's bladder infections. And they just pumped me with antibiotics, as they did.
Of course.
I mean, I'm almost 40 now, so we're looking at a good 30-something years ago. And then in my teen years, obviously it got worse with menstrual cycle, like the cramping, and all that fun stuff of being a girl. And then, once I was sexually active, it was really, it got worse and worse and worse. And it was just really sore and uncomfortable and tight. And I went to go to gynaes, and they were all male at the time. And they all said to me, we can't find anything wrong. Maybe we should do surgery. And I was
course.
like, on what? Like, what are you doing surgery on? Apparently there's nothing wrong. And they're like, oh no, we can cut the vaginal canal and make it bigger. And I'm like, so you're gonna put scar tissue in there? How is that helping the problem? Like, what are you
Oh
gonna
my
cut?
God.
It was just crazy. So I kept searching until I found a very nice female gynecologist. Again, she didn't ask me about pelvic floor. I said to her, I have this issue, and this was my early 30s now. So I'd been struggling for a long time.
Wow.
And she says, you need to go to see a pelvic floor therapist. And I said to her, I don't know, what is that? I'd never heard of this. Like in movement science, it wasn't a thing. So I went to see a pelvic floor therapist. It was super weird because the therapist, all she did was pelvic floor all day, every day. So she was kind of like cold about it, which was really
Oh,
weird,
okay.
very invasive, very kind of like time
Black
to
and
go.
white.
And then, and then she pulled out this electrode thing. And I was like, I'm sorry, you're putting what where?
I
Did you
also
get
had
my
that.
consent?
I also had that, and it was weird. And I was like, "Are you electrocuting my vagina?" And she's like, "No,
Yeah.
Just
no."
kickstarting it.
Yeah, just
And it was amazing. She found trigger points in there that were linked to my diaphragm. Like the one actually made me stop breathing. I actually said, you have to stop because I can't breathe. And she was like, what do you mean? I'm like, you have to stop. So it kind of started my journey on this, where I sat and thought, this is amazing. I have worked with so many patients with chronic pain in this area that there was nothing wrong physically, but they had so many symptoms. And it completely changed my way of practicing, how I looked at pelvic floor, myself, my patients. I phoned some of them back and I was like, look, nothing we did worked. Let's try pelvic floor. Let's see what happens. And that was kind of the missing link. So it's
Wow.
really something that now I integrate in the practice since then, for like the last decade, just really
important.
integrating it. It changed me on a personal and professional level. Like you say, you walk out completely changed. It's really weird, but
I wanna do
during
this
I have the dilator in the next room. I'll help you. I want
Just
to.
get our session going.
Walk us through it, Michelle.
Right?
I'd rather not, but I'd rather wait till you do a docu-series and then you invite me to watch. That'll be fun.
I definitely do not want to be
Actually,
a part of this.
we're gonna be booking this here because I'm very interested.
It is so cool. It is like honestly, the pressure that it takes off of you, don't realize how tight that area is, especially if you're like, well, again, for me with my husband, like I couldn't enjoy intimacy because it was so painful. Then it was like, okay, just do this. I'm just gonna like bite on something and like just do this. And it's like that's not really hospitable for anybody involved, you know? So it's like it does give you a little bit more freedom in that department to enjoy things as well. So
I agree.
yeah, this is cool.
And also it's super important to enjoy sex with your partner, because it starts becoming stressful for both of you, because he's kind of going, okay, is she just going to push through for me, which I don't want to do either, because like, am I hurting her? Because then they also feel like monsters, they're kind of like, oh my God. And then we're already going, before we've even gotten anywhere near foreplay, you're going, is this going to be sore? Like, am I going to be stressed? Is he going to hurt me? So that thought process already starts to create tension, unfortunately. So it's so, especially for females, it's so emotional and mental too. Even the act of intimacy for us, right? The whole thing just kind of
But then like after I do it, I'm sore for 2 days afterward, and I'm like, why? How do people do this lots of times a day? Like this is not enjoyable for me. Like, this is so uncomfortable. So I mean, I know that I need to like be more proactive with the exercises that she gave me. I haven't seen her in about a year, and I'm thinking like, yeah, I should probably take advantage of that again, because it is incredibly relieving.
Well, we're making appointments.
Yeah, we're going.
Joint appointments together.
Yeah, that's right. The
Joint
couples
appointments.
session.
Couple session.
So why don't you just quickly let everybody know about like your studio? Do you do anything online, or are you everything in person? Like how does it work in that sense?
Most of my consultations are face-to-face in our studio. I do online for certain patients who are traveling, and I am trying to do more online work. Certain things I cannot do online, right? The actual, physical release,
Of
I
course.
can't do.
Yeah,
But
of
in
course.
terms of like explanation, teaching, I do have online workshops that I do. I do courses as well. So that's kind of from an online platform, is a lot of education and things that people can do themselves at home. So kind of a lot of proactive behavior and also just prevention. You don't have to wait to have a pelvic floor issue to take care of your pelvic floor. So women already in their 20s and late teens can already start taking care in a healthy way.
I love that.
Yeah.
Education is like so empowering just to be able to know. I mean, you don't know what you don't know. So the fact like women, we know that it's a possibility that this can happen. It's nice to be proactive in that
Exactly.
as well, or to know you're not alone as well. Like you've never even heard of this,
Yes.
and you're just like, dang,
And
this
I'm pushing
might
40 in
actually
a few months here.
Exactly.
Yeah.
So I love that. Definitely continue what you were doing. It's amazing. I hope to see like more courses and like documents from you, like things that people can take to do at home. Because for I think a lot of people, it's like embarrassing to go in person. But like if I can do something even just in the comfort of my own bedroom and feel a little bit better, that would be cool. I would pay for that for sure.
Right.
Yeah. And a lot of people need that at home step before they go see someone. They
For
just
sure.
want to get more comfortable, and sometimes people don't need more. They're like, oh, I just needed to fix my breath. Oh, that's so much better. Or I just needed to understand why this was so painful, or how to relax before sex. How to change things, the intimacy process too. So those are things we kind of work through as well. It's like I said, a lot of what I do is actually a lot of teaching and explanation, and already that is like a huge mind shift.
It is interesting. I'm also finding it interesting too, like a lot of people hold trauma and grief like in their lungs, which causes breath to not, be as beautiful as it should be. It's
deep.
very labored. You're not oxygenating nearly what you could. And now that it's like all connected, like no wonder trauma can affect that.
Big time, because your diaphragm is directly related in the stress process.
That's so
If
cool.
you think about catching a fright and you're like, right, that's just
Yeah.
diaphragm all there, right? Woo.
Well, then you do that and everything sort of lifts
Yeah.
at the same time, right?
Yeah.
See, look at that.
Yeah.
And for some, squeeze out a little. Well, thank you so much, Michelle. I really appreciate you being here. We have
Thank you.
literally learned so much.
Honestly,
like
this was
this
really
isn't
good.
new information to me, and yet I feel like I've learned so much today.
This is good.
Thank you, ladies. This was really, really, really fun for me as well. So thank you so much for having me.
you.
It was
Of
lovely
course.
chatting to you.
Yes,
And yes,
you also.
Thank you.
thanks.
Amazing. So Human.Kinetic.Studio.com, check her out there. You might not live in Portugal, and that's okay. There are definitely pelvic floor therapists in your area. It is worth it. But I would go check out her page and see just like how you can connect and how you can learn more about this. It is incredibly important to take care of your pelvic floor, because as we've learned today, like there is a lot of different areas, sex, bladder, defecation, like all of these things, comfort, sitting on a chair, very uncomfortable. So
it all makes sense now.
Yeah, it all makes sense.
Well, once we go to our appointment and find out,
live stream it.
Yeah.
Just kidding, that's not happening. Yeah, once we go to our appointment, we'll talk more about it.
Because then we'll get the knowledge.
Well, I mean, I've been there. Like I said, I have all the tools at home. It's just a matter of doing it. I do find like if I haven't done my exercises in some time, it hurts. It's painful when I go to do them again. But it's like, I don't know, I'm just picturing like everything like collapsing inside. And it's like I want to loosen them up.
We got to get going on all your stuff, and then you'll be okay.
Yeah, right. Like my husband will walk in and I'm like, I'm exercising.
Doing my workouts.
Get out of here. This is a private moment. I'm like, oh, it is awkward. Whatever. Anyways, Dad, don't listen to this episode. And be back next week where Ashley and I are just going to talk. We're just going to talk about what is going on. We've been promising that episode for like 9 weeks now. So we're finally going to do that. We are also going to be taking a little break, but we will talk more about that also. So anyways, thanks everybody. Check us out, 2 Girls Without Cancer, and we will see you next week.
Thank you.